Seniors, I need you to listen closely, because what I am about to share with you today could save your life or the life of someone you love. As a doctor, I've sat across from too many families in tears, wishing they had known the truth earlier, and here it is. Nearly half of seniors over the age of 60 experience the warning signs of a heart attack, but they brush them off as indigestion, stress, or just getting older. Tragically, many never get the second chance they deserve. That's why I'm here. In the next few minutes, I'll reveal the 3 earliest and most often ignored signs of a heart attack, and I'll also show you how you can prevent it, starting today with small but powerful changes. Please stay with me until the very end, because your heart, your future, and your family's peace of mind may depend on what you hear today. Let me begin with a story. One of my patients, Harold, was 72, a gentleman, a grandfather who loved tossing a ball in the yard with his grandkids. One evening after dinner, he felt a dull pressure in his chest. Not pain, just pressure. He told his wife, "It's probably just indigestion." Later that night, he woke up sweating, his jaw aching. Still, he brushed it off. By morning, Harold was gone. His family was left devastated, asking, "Why didn't we know? Why didn't we see the signs?" I don't share Harold's story to frighten you. I share it because it is far too common, and I don't want you to be caught off guard. The truth is, your heart often whispers before it screams. And if you learn to listen, you can catch trouble early and protect your life. So let's talk about those 3 early warning signs that seniors must never ignore. The first is unexplained fatigue. We all get tired after a busy day, but this is different. This is the kind of deep, crushing exhaustion that makes no sense. You wake up after a full night's sleep, yet you feel drained. You start a small chore, like making the bed, and suddenly you need to sit down. Many seniors dismiss this as normal aging, but it isn't. In fact, in women over 60, unusual fatigue is one of the most common early signs of heart trouble. It happens because your heart isn't delivering oxygen-rich blood efficiently. Your body is warning you. Something isn't right. The second sign is shortness of breath. Not after climbing mountains, after simple, everyday tasks. Walking across the room, climbing a few steps, even lying down in bed. Some people even wake up at night gasping for air or find they need extra pillows to breathe. This is not normal aging. It's your heart struggling to keep up. One of my patients, Margaret, 68, thought she was just out of shape. But when she couldn't finish singing Happy Birthday to her grandson without feeling winded, she finally came in. We discovered severe blockages in her arteries. She was treated in time, and today, she says that one choice to listen saved her life. The third sign is discomfort in unusual places. We imagine a heart attack as crushing chest pain, but for seniors, the discomfort often shows up elsewhere. It may be in the jaw, the neck, the shoulders, the back, or down the arms. It can feel like a dull ache, a strange heaviness, or even just a nagging discomfort that comes and goes. One of my patients once told me, "Dr. Mark, it felt like I had slept wrong on my shoulder." In reality, he was experiencing the first warning signs of a heart attack. Especially in older adults, nerve changes can mask the classic chest pain. That's why any odd, lingering discomfort should never be ignored. Now, here's the part I want you to hold on to. You are not helpless. Recognizing these signs is the first step, but protecting your heart every day is just as important. So, how can you do that? Let's walk through it together. First, eat for your heart. Your diet is your strongest medicine. Trade fried foods, heavy salts, and processed snacks for whole grains, leafy greens, beans, nuts, and fatty fish like salmon or sardines. Foods like walnuts and flax seeds are rich in omega-3 fatty acids, which help reduce inflammation in the arteries. Think of every bite as either clogging your arteries or clearing them. Second, keep moving, even gently. Your heart is a muscle, and it thrives when it's exercised. You don't need to run marathons. Just 20 to 30 minutes of walking, stretching, or gardening daily can strengthen your heart. Chair yoga or water aerobics are excellent for those with joint pain. The key is consistency, making movement a daily habit. Third, monitor your health numbers. Blood pressure, cholesterol, and blood sugar are like the dashboard lights in your car. When they're out of range, it's a warning. Too many seniors tell me, "But I feel fine." Yet silent blockages may be building up for years. Regular checkups help us catch problems before they become dangerous. Fourth, reduce stress and protect your sleep. Stress hormones like cortisol raise blood pressure and strain your heart. Poor sleep robs your body of healing time. Practice deep breathing, prayer, or meditation. Protect your sleep environment. Keep it dark, quiet, and cool. Your heart beats 100,000 times a day. It deserves rest. And fifth, don't ignore small signals. If you feel something is off, don't minimize it. Too many seniors wait, hoping the feeling will pass. But minutes matter. Getting checked could mean the difference between life and death. Let me tell you about James, a 75-year-old patient of mine. He had brushed off years of mild fatigue and jaw pain. But one day, after hearing a talk like this, he decided to get checked. We discovered severe blockages. Surgery saved his life. Today, he walks his dog every morning, plays piano for his church, and always tells me, "Dr. Mark, if I hadn't listened that day, I wouldn't be here now." Another patient, Evelyn, 70, came to me after months of back pain she thought was arthritis. She said, "It wasn't that bad, just annoying." But testing revealed heart disease. We intervened, adjusted her diet, added gentle exercises, and today she's thriving. Her grandchildren call her their super grandma. I want you to imagine yourself like Evelyn or James, living years longer, enjoying birthdays, holidays, and quiet afternoons with loved ones. All because you listened, acted, and gave your heart the care it needed. So, let me repeat. The 3 early signs of a heart attack you must never ignore are unexplained fatigue, shortness of breath, and unusual discomfort in places like the jaw, neck, back, or arms. If you feel these symptoms, call your doctor. If they're severe, call 911. Seconds can save your life. I want you to picture your future. Imagine yourself 5, 10, even 20 years from now, sitting on your porch, watching your family grow, your heart beating strong because you made choices today that gave you time tomorrow. That future is possible, but it depends on what you do right now. And here's what I'd love from you. Share your story. Have you ever felt these symptoms? Do you know someone who ignored them and later discovered heart disease? Your story in the comments could inspire another person to take action, and maybe even save their life. And before you leave, do me a favor. If this message touched your heart, if you learned something valuable, please give this video a thumbs up, subscribe to our channel, Health Hackers, and share it with your loved ones. Because somewhere out there, someone you know may need this message right now. This is Dr. Mark reminding you, your heart is the engine of your life. Treat it with love. Listen to its whispers and protect it with everything you have. You deserve many more years filled with laughter, love, and life.